I'm Ali.
And I'm Becki.
We are registered dietitians that believe in the power of food as medicine, and we take functional approaches to optimal health.
In today's video, we're going to be covering why food allergies and food sensitivities are on the rise, the difference between the two, our favorite way to test for food sensitivities, and our 3R approach to optimize your gut health.
Yes, so the unfortunate reality is that food sensitivities and allergies are both on the rise. And there are multiple reasons why this could happen, but the majority has to do with sterility and lack of a robust microbiome. So we see sterility from the abuse of antibiotic prescriptions. We're seeing more and more antibiotics prescribed in youth for things like ear infections. We also see sterility from the overuse of antibacterial products. So your hand sanitizers and soaps, and even some children's toys have antibacterial compounds in the materials. Also, we see that there's less breastfed babies. So when you are formula fed, you're not getting that active probacteria in the breast milk as you would have. And cesarean birth versus vaginal birth will create that sterility, not giving that initial thumbprint of delivery through the vaginal canal.
Yes, I even saw some antimicrobial baby clothing while shopping recently for our
No.
baby. I'm like, nope, I want the opposite of that, please.
Yes, give me the low jeans,
Yes,
give
yes.
me the dirt. I mean, we've seen in research that kids that have actually, the more pets that you have in the household, the less inflammatory response and the more robust immune system. So we do want to have access to bacteria, virus, to actually create a robust immune system. It learns through exposure.
Yes. And then beyond that, increased consumption of hyper-processed foods. So seeing increased consumption of hybridized gluten in the diet, which can really disrupt the tight junctions of our gut and drive leaky gut. We can see increased consumption of things like GMO soy and corn that can actually have higher residue of glyphosate, which can also wreak havoc on the gut lining.
Yes, it's pretty impossible to find anything in the middle of the grocery store that's free of gluten, soy, or corn, especially when we're talking about additive ingredients like maltodextrin and soy lecithin. So all of these additives, beyond whether it's a GMO origin or a hybridized crop, a lot of these additives are also chemically derived, and many of them can be gut irritants. And then you brought up the idea of leaky gut.
Yes.
So I think we should unpack that for sure. So leaky gut can be exacerbated by these same reasons as well as stress alone. Stress can actually drill holes or destroy your gut integrity and lining. And when we're talking about this concept of leaky gut, we have microvilli, or these finger-like projections that line our intestines. And we can get damage to the microvilli based on stress, chlorine in our tap water, antibiotics, medications like NSAID drugs, so your Aleve, your Advil, etc. And what happens is we get increased gut permeability, or the villi get damaged, so there's larger spaces between the tight junctions, and now larger food particles get into the bloodstream, and the immune system kind of goes in over attack mode. It's overburdened by the high amount of antigen or compound that's circulating in the bloodstream that really should have stayed in the intestinal tract.
Yes, and so we are seeing both food allergy and food sensitivity increasing. Food allergy, let's distinguish the difference between the two of those first of all.
So food allergy is often an immediate onset, an IgE mediated reaction. And we tend to think of things that happen quite rapidly in the body from a food allergy. And we think of things like peanut allergies or shellfish allergies, where you can get swelling, you can get hives, you can get puffiness in the face or eyes, we can get stricture or closing in the throat and wheezing, and influence in our respiratory tract, really experiencing anaphylaxis as a severity.
Totally. So those life-threatening reactions would be more of a food allergy response where you need an EpiPen or you need to take Benadryl to kind of knock that out. And then with the food sensitivity, you'd be seeing less severe onset of symptoms. In fact, you could be seeing up to like 72 hours of delayed reactions. So sometimes it's really hard to distinguish what food in your past 72 hours caused the reaction. And typically these symptoms are more along the lines of nausea or bloating and distension. We might see diarrhea or the opposite, constipation, or we might even see that extending to things like joint aches or skin conditions.
And even things like brain fog, difficulty concentrating, and just inflammation in general, we can start to see that CRP, that marker of inflammation, go up in an individual that's consuming things that their body is sensitive to, because that creates an inflammatory process.
Let's talk maybe a little bit about the testing. Like, how do we find out if we have food sensitivities and what foods they're to?
So now it's estimated upwards of 20% of Americans are experiencing a food sensitivity that's hindering their optimal health outcomes. So there's been a plethora of tests that have become available direct to consumers. These can be as a blood spot that you mail in or that you go and get a blood draw. The unfortunate reality is the majority of these tests, whether we're talking about Pinner or the Everly Well tests that are available, they're only looking at an IgG delayed sensitivity. This is only 25% of your food sensitivity response. So we're only looking at a quarter of the opportunity. And also an IgG reaction has upwards of 70% false positive. So it could just be a neutral association. For instance, if you eat almonds every day, there's a high likelihood that you'll have an elevation to almond. This can lead to daunting results because by removing these commonly consumed foods, you may not get clinical outcomes. You may not reduce the inflammation in your body, and you might be overlooking that 75% of information that you need to really reduce the inflammatory response.
Yes, and could have you overly restricting the diet unnecessarily and really not getting that root cause resolution.
Yes, so we like to use in the Naturally Nourished Clinic the MRT test. This stands for Mediator Release Test. It does include those type 3 IgG reactions within its consideration of its panel, but it also layers in the type 4 reactions in the body. And this includes our T cell, our lymphocyte reactions. It also is going to include, more importantly, our immune mediator response, or basically the inflammatory chemicals. So we're talking cytokines, prostaglandins, leukotrienols. These are the chemical compounds that drive the inflammatory reaction. So when you get your MRT test, you're actually looking at a GPS for your body of what's driving inflammation based on what you put in your body. And we're not going to have that high susceptibility to false positives.
Yes, and so we'll unpack what an MRT looks like and how we actually apply our entire protocol, which is a full 6-month protocol, pretty extensive with some supplement support. But let's get into first our 3R approach.
Yes. So I think we'll do an entire video on my personal results and walk you through how to navigate that. And you can see what an example panel looks like. But generally in clinic, when we're using a functional medicine approach, we're looking to remove the irritant, restore optimal digestive processes, and then repair that leaky gut. So the first start is to remove inflammatory foods. You could start point blank with just the top 5 inflammatory foods that I identify in the anti-anxiety diet. So this could be corn, gluten, soy, dairy, and refined sugar as a starting point. But if you think you need to dig deeper, then you'd have to use the results of your MRT panel to aid in that removal process to identify what you have to take out.
Yes, and it's kind of like this concept of you can't rebuild a house that's on fire. So you have to remove that irritant. And irritants can also include things like additives, which the MRT does screen for, and overgrowth of yeast or bad bacteria, which the MRT screens for candida as well.
Yeah, so part of the removal might actually be doing the Beat the Bloat cleanse to remove the overgrowth. And that kind of takes us to this concept of restore, restoring optimal digestive function. So this is where we're starting to look at 2 of our featured supplements in our Digestive Basics bundle. This is what we use in clinic with the MRT protocol. So we're taking Digest Aid prior to meals. This is going to give us the enzymes that help to break down food particles, carbs, proteins, fat. This also has lactase to break down the lactose. It has our HCl, or hydrochloric acid, to optimize our digestive juices, and ox bile to aid with fat absorption. So when you take the Digest Aid prior to your meals, this is going to ensure that there's an optimal kind of cauldron, if you will, in your belly. So when the food hits the stomach, everything gets broken down appropriately and smaller particles are being delivered to your immune system as well as to your gut lining. So less damage and less hit of those potential irritants.
Yes, and a fantastic tool even for those who don't have MRT results in front of them to navigate quite yet when you're dining out or exposed to something when you have a suspected sensitivity.
Most definitely. And then the other element of restoring optimal digestive health is in our probacteria. So doing the Restore Baseline Probiotic 1 at bed is appropriate, and you might determine that you want to do the probiotic challenge throughout this to assess the status of your microbiome. But really getting an optimal balance of lacto and bifido strains is a great way to support optimal digestion.
Yes, and those bacteria also help to break down our foods, which in turn can lessen food sensitivity and lessen that effect of sterility.
And tonify the immune system so it's not having as much of a white blood cell freak out in response to the food. So
Totally.
big coverage there.
Win-win-win.
Yes, the final one, which is one of our really popular formulas, is our GI lining support. So I use this with any patient that has inflammatory bowel disease, Crohn's, ulcerative colitis, you name it, because this plays a great role with L-glutamine, which is a amino acid that serves as a fuel source and a building block to our enterocytes, our gut cells. This has actually been shown in colonoscopies to actually repair the tissue, the lining of our GI tract. This incorporates, along with the L-glutamine, DGL, which is diglycerized licorice root, and aloe. So it's providing a mucilaginous or oopy-goopy delivery of that glutamine so that along the GI tract, we're coating and repairing.
Yes, and I can't tell you how many clients I come across that have done some form of food sensitivity testing in the past, but maybe not hit these other elements, and we're kind of back to square one where we need to actually get in there and add some supplemental support.
Yeah, if you just remove the lighter fluid, but you don't repair the house or restore the environment, provide that foundation, you're not going to get long-term effects. Hopefully this video serves as a resource to help you to navigate what's going on in your body and maybe validate that you may be experiencing a food sensitivity, as well as providing you direct tools that you can use to empower yourself to take back control of your health. I hope you found it useful, and if you did, I encourage you to subscribe to our YouTube channel, where every Thursday we release functional medicine and food as medicine videos to support your wellness journey. Be sure also to comment, like, and share, especially if you have a loved one that you know would be benefited from this information. And together as a community, I don't know what I can say. I don't want to say please, but a comment below. Okay, I said something. Please like, okay.
Please like us.
Yes.